Well, when you're comparing surfaces with ACL injuries, I think you have to go back and look at the biomechanics of it. There's a lot of precursors that we look at as allied health professionals in terms of when we go off and evaluate what people are at higher risk than others. The surfaces themselves are certainly a problem. When you have the artificial versus the natural turf, the length of the turf certainly plays into whether the cleat is going to grip in, whether the surface is wet or whether it's dry, the thickness of the padding that may be up underneath the artificial surfaces, or if there's a heavier mix of the granular surface that actually kind of is woven into the artificial surfaces. Those are all have variables. When you look at the natural turf aspect of it is, again, is the subsurface a sandy loam, which has a tendency to give and take a little bit more versus a harder compacted type of soil. That certainly has a variable as well. Certainly with the natural turfs, you got that height and how high it's been cut, how high it's been maintained, how thick the mat is. Again, those are all variables that you have to take into account. So surfaces are one thing. The environment, certainly I mentioned the fact whether they're wet or whether they're dry, how much it retains moisture because of the dome in which it was built upon is certainly a factor for the athletes as they run and cut. You have the cleats themselves. Cleat manufacturers have a standard boot that they utilize, but they also have different types of cleat formation that will determine whether they have more cleat in the forefoot around the shoe box of the cleat or back on the heel and around the heel cup as well too. Nike's variation is much different than Puma, much different than Adidas. Reebok is out there. There's a few others that actually manufacture a lot of soccer cleats as well too. So all those things combined are things and variables that you have to look at when a potential higher risk student athlete is going to have to deal with ACLs. Then you look at the individual themselves. Are they at a higher risk because they have a muscle imbalance between what their strengths are with quadriceps and hamstrings and what's pushing and pulling at the same time? Is there a balance between those things, both left side, right side, dominant side versus non-dominant side? With the female student athletes, there's always a risk because the Q angle is a little bit greater than it is with the male athletes. So you have to take that to account as well too. Positionally, there are things that you have to worry about. Keepers usually kind of do sort of front and back. They do very little lateral movement, at least not over to an extreme. They're within the box themselves versus the defenders that have to be able to change direction, possibly go into slide tackles and that sort of thing. So what gets caught up in the turf as a result of going down in a slide tackle, especially when the opposing player is coming at you or trying to get away from you, those are all variables as well too. So again, you look at flexibility of the student athletes, you look at their overall strength and is there balance within their strength? Is there proprioceptive ability to be able to change direction at a particular time, especially as the play moves in and around the player? Those combined with the surfaces themselves, you probably lend to the fact that we're going to see more and more injuries that are going to occur. I think probably with the artificial surfaces. I know there's lots of different studies that are out there, but again, there's a lot of variables inside there. You have surfaces that even with the natural turf, when you're up in the Northeast, are much different than when you're down in the Southeast, or if you're out in the West Coast. It's much different than Southern California than it is if you went up into the Seattle area as well too, because again, the subsurfaces are a lot different at which they're built upon. So, again, as allied health professionals working with student athletes, it's a combination of what the physicians and their knowledge is in terms of how they go about diagnosing these injuries, then ultimately the right repairs if they're going to be necessary for them to continue to be competitive. But the bottom line for those folks is making sure they have a good knee so that they can continue to have a good working functional joint that allows them to be able to live once they get done with their competitive playing days.